with this quick scenario, mesothelioma. In a vital medicine, patient is 60, came for the chest X-ray report, and X-ray shows bilateral pleural thickening. Talk to him, assess, and discuss this report. Bilateral pleural thickening, not a good sign. It's a sign of mesothelioma. Patient might be working in asbestos industry, and it might be a case of lung cancer. All right, so what you need to do is, I'm here for my X-ray report. Okay, and then what I'll do, okay, I've got your Excel report with me, and before I explain it to you, I would like to ask you some question. I want to do a quick assessment of you. I just want to know why you had this X-ray. The patient had a fall a few days back, and my doctor had requested for it. How this fall happened and all, you can ask a bit of things. So it is kind of an accidental finding according to this question, right? But then when we know bilateral pleural thickening, so we know the reason is cancer. It can be in some infection as well, like tuberculosis and all. So what you need to do, now you start asking question. You ask question, any other problem? Any cough, any shortness of breath, any loss of weight, any appetite loss, any palpitation, heart racing, you feel tired or malaise these days, any fever, flu-like symptom, any night sweating if you have got, any lumps and bumps, any part of the body, right? Any problem with the swelling. So all those questions that you ask in normal cancer question or infection, you will ask here as well. All right. And then a quick past personal social history. Make sure you are not missing smoking. You are not missing occupation. And you are not missing family. Right? And would like to do your chest examination, some investigation, routine blood, and sputum test as well. Okay, and then you explain it to the patient, do a very good eyes, and after that you will explain there is a possibility of cancer as well, right? I discussed it already, I discussed it yesterday, I mean, we discussed it previously as well, so I don't want to go into detailing. So as patient has in the medicine, so fine, what we're going to do, we're going to admit this patient. If the patient is in the respiratory department, we're going to admit this patient, we're going to carry out further investigations as well. All right, because the X-ray shows that there is some thickening in the lining of your lungs. It could be because of many reasons. One of the reasons could be infection as well. But when I asked you the question, you didn't have any sign of infection. But it could be something serious as well. Serious it could be lung cancer as well. Right? So that's what we need to do. So if you're in the GP, 2 weeks referral, but if it is a specialist, you'll admit the patient and you will investigate the patient. Right? And mesothelioma is not very easy to treat. It's going to be tricky. And it depends on, the treatment depends on many things. Treatment depends on if it is cancer or not, first of all, and where exactly the cancer is, what's the size of it, if it is in one place, if it has spread or not. So you have to see a lot of things, right? And the treatment is not only me who's going to decide. It's going to be decided by the MDT, multidisciplinary team. So the radiologist, chemotherapist, surgeon, occupational therapist, nurses, GPs, everybody's going to sit together and then decide on that. Right. So same thing. I'm not going to go in detailing of it, but yes, bilateral pleural thickening, mesothelioma, asbestos, TB, just keep these things in your mind. All right.